So sports medicine, it does have a kind of a wide variety of people you can treat. It's in general related to exercise and activities and injuries, overuse injuries, sprains, things associated with that. Does not necessarily have to mean just professional athletes or high school athletes. Happens to a wide variety of people, the weekend warriors, kind of even industrial things, tennis elbow, rotator cuff injuries or tears. I grew up here in Coeur d'Alene, grew up playing a lot of sports and enjoying kind of the Northwest here, and was able to play soccer at Gonzaga, and then continued on to medical school at University of Washington, and then residency in Hawaii, and did a sports fellowship in San Francisco. We helped provide sports coverage and treatment for the San Francisco Giants, as well as Santa Clara Broncos collegiate team, as well as University of San Francisco. So I was able to kind of get around the Bay Area and help take care of lots of professional and semi-professional athletes around there. Choosing orthopedics in general, my background in sports and activities kind of pulled me a little bit more towards that. I like to be active, so it kind of felt like a natural fit to help keep other people active. So, you know, anyone from kids with broken wrists to elderly patients with broken hips, we see a little bit of everything. Getting people back to whatever was limiting them or bothering them, and you know, hopefully be pain-free and have their full function after. I think our office is a kind of a warm, nurturing place, from the receptionist to our MAs to myself and my physician assistant, you know, hopefully understanding this and helping people get through. I tell people orthopedics isn't cookbooks, so there's not a certain thing for every patient, and we kind of have to kind of get on the same level and figure out what's the best for each individual person. My philosophy, my practice, I'm not one of those paternalistic type physicians where we kind of dictate or tell you how things should go. I think that this is more of a patient-centered interaction. And I feel like my job or my goal is to kind of lay out options and help come to a best decision for each patient, and that might not be the same for everyone. I think that it's a little easier to relate, having been through injuries myself, playing, that it's easier to understand kind of where they're coming from and the pulls they have. Kind of be able to see things on their level is nice, as opposed to just kind of, you know, cookbook and a rehab and saying, hey, this is where you should be and what you should do and how we can work around those things.